This episode of HIPcast is brought to you by Enterprise Social Record, the only closed-loop referral solution for social determinants of health needs built with health information expertise. ESR allows clients to assess, refer, report, and trend the SDOH needs of people in their care. Report quality metrics like HEDIS and MIPS. ESR provides real-time CBO engagement in community-specific ecosystems with Z-coding and engagement in an anti-fraud framework. For more information, visit www.enterprisesr.com. And I want to welcome our guest, Keith Olenik. Is that how you pronounce your last name?
Close enough, Seth. That'll work.
Close enough. Well, being an East Tennessean, the pronunciations of things are often different. So I will do my best as we do this. And let me introduce Keith through his bio. Keith has 40 years of experience working with a variety of healthcare organizations as a member of executive leadership and a consultant. He is focused on advancing the health information profession with his current role at the Olenik Consulting Group to meet the industry needs and provide necessary education to advance individuals working in the health information space. Previously, he has specialized in methods to streamline business operations, evaluate and implement information technology solutions, and enhance performance through process improvement. Keith, over his career, has assisted many healthcare organizations in the development of strategies to support EHR optimization that included workflow design, staffing requirements, and documentation integrity processes. Keith holds a BA in Health Information Management from the University of Kansas, go Jayhawks, and an MA in Health Services Management with an emphasis in Computer Resources Management from Webster University. He is currently the principal and owner of the Olenik Consulting Group. So what a background. It's exciting to have you here, Keith, with us.
Great. Thanks.
Good morning, Keith. It's so good to see you.
You too, Shannon. We've talked a lot, but I'm excited for us to dig into this topic today.
Yeah. It's been really good to catch up with you lately, and having done some service with you in the past, as myself as a member of volunteer groups, I have just such great respect for you, and I'm so excited to get to hear what's coming today. A lot of things for Seth and I both to learn today. I'm not sure how much we'll retain, but we're going to try to retain something from every cast that we host, because it kind of shows the diversity of our profession as health information professionals, because there are domains, as Seth has mentioned before in the show, but there are also pockets of new information, new ways to serve, new roles popping up, more and more data that we need to manage and understand and know how to respond to, how to protect, what's appropriate, what isn't. So I'm thrilled to have you here, and it's always really good to see your face. So thanks so much for coming.
You bet. Thanks for the invitation.
So the topic today is data literacy. And I laughed when we were doing the prep emails on this of data literacy, because I thought, I don't know what that is. So this is going to be a really fun podcast just to help me understand what data literacy is. So I guess let's start off the podcast with that, Keith. What is data literacy?
Well, Seth, when I've been talking about this for probably about a year and a half or so, and I think it's predicated on the fact, like Shannon started to say, there's a lot of data out there, and the healthcare industry as a whole is evolving. COVID really caused us to do some huge shifts just in how we did our work. But going back even further, with the 21st Century Cures Act and with the EHR incentive programs that were done by the government, we went from paper. Now, you said 40 years. I'm old. I'll admit it. I'm experienced. But when I started in the field, it was all paper. You had a little bit of computers. You had to do manual abstraction. So the amount of data that you had was pretty limited, and it was very focused. If you were going to take the time to manually abstract, you knew exactly what you were doing. Now we have so much data that it's become almost unmanageable. And I think that's where healthcare is. So to kind of give us some foundational things here, Gartner defines it, and I'm going to read it. Data literacy is the ability to read, write, and communicate data in context, including an understanding of data sources and constructs, analytical methods. Don't get scared. We're going to talk a little bit more about the analysis piece of it, the techniques applied, and the ability to describe the use case, application, and resulting value. So if we look at kind of going back to what literacy is, if you remember, I don't remember which president's wife, maybe it was George Bush's wife, who took on a literacy campaign, if I'm remembering correctly. So I probably should have thought about this a little bit more. But literacy of reading, being able to read and write and communicate, I think now we're just kind of putting a different spin on it, specifically about data. Because while data can be words, it's also can be values and can be a whole host of other things. So it's not as simple as understanding the alphabet and then kind of going from there as we started in kindergarten. Now they're probably doing it in preschool and whatnot. But data literacy at its core is just what that says. And I'll look at another one from the Harvard Business School, and that's another great resource if you want to go out, and we'll talk a little bit more about resources later. But it's the term is used to describe an individual's ability to read, understand, and utilize data in different ways. And I think that's really critical to how healthcare is struggling in how do we know what data to use with what situations. I sat next to a CMIO at a conference back about 6 months ago, and we listened to a presentation, and he told me what his role was, and I'm like, okay, I'm going to try to make a plug for our profession, but asked him the question of, what do you think the biggest challenges are today with your workforce? And he said, data literacy. So he said people within our healthcare organizations at every level do not understand the basics about data. And unless we're taught that, like we're taught about reading and writing, we're kind of missing the boat. So I think that's a competency that we're going to need to add into all of our coursework starting at an early age, preschool, first grade, wherever you want to go. But those of us who have been around a while, there's a lot of opportunities for us. And like Shannon started to say, we have a really strong foundation in health information. So I don't want us to sell ourselves out. We know medical terminology, we know pharmacology, we know a lot of the data components and the sources, but we just need to be confident in what we know and then build upon it to really then become a data literate person.
Wow. Keith, I want to interject for a second. First of all, let me say, I love the Harvard Business School's definition. It is so simple, right, to understand the variations there. But I want to kind of throw something at you based on that definition and what you've said so far. So it's talking about how we use it differently. And I think about primary research and I think about diagnosis or procedural coding, right? You collect it once and you use it often.
Correct.
How many uses, or let me go back and read the definition again. Let's see. It says how to read, understand, and utilize data in different ways. How many different ways can an ICD-10 code be used?
Well, that's a really good question, Shannon. And I think it would come to, why are you wanting to use the data? And
Yes,
then
exactly.
It's, what is the problem you're trying to solve? I remember back many, many years ago, and we had a business intelligence unit within our organization, and they were not clinical people. They were not health information people. They had been in finance. Some of them were technology, but they had somehow raised their hands, or somebody had lumped them together because they were really good at running reports, and especially financial reports. So they didn't have the predicated knowledge. and somebody asked them to run a report on admitting diagnosis, based on admitting diagnosis. So those of us that work in healthcare and understand coding,
Yep.
the admitting diagnosis for the most part, and I hate to be so crass, it's a junk code. You show up
Yeah.
to the emergency
It's a
department
filler.
and they say, "What's wrong with you?" And I say, "Oh, I'm dizzy." Okay,
Uh-huh.
so that's my admitting diagnosis, is dizziness or syncope or
Or
something.
I'm having chest pain to get into
Right.
the ED faster.
Right. Oh, well, that's a good one. But then you know how to use data, and so you're already a step ahead of us. But what they were trying to do is find out what are the primary things that we're dealing with in the ED. And I'm like, you don't want that admitting diagnosis. You want the final diagnosis, or whatever term you use within an ED record, to know at the end of
Mm-hmm.
study, it's not necessarily the principal diagnosis, but so it's understanding how those codes are applied to different data fields to then understand what is it that we're trying to answer? What is the problem we're trying to solve, or basically the question we're trying to answer, and using admitting diagnosis in that particular case. While it's a code, to your point, it wasn't the right field to use where that code had been applied.
Yeah, and also with diagnosis codes. I mean, ICD. I don't even know. I guess we'll start with version 1. But the intent is for disease process and identification of disease and prevalence and trauma and statuses, family histories, things like that. So the point is to collect scientific clinical information. However, now we use it to transact. We use it to for revenue cycle. We use, like, there are so many ways to use it, right? So to your point, how are you using it? So the literacy depends on what your background is and your use case, I suppose. I love this definition and this conversation. Thank you,
Right.
Keith.
You bet. And the one other thing I want to add, and I did a quick little look up this morning, but people I think are going to possibly either get overwhelmed or confused. And the Harvard Business definition says it doesn't require an individual to be an expert, such as a data scientist or analyst might be considered, but rather to show an understanding of the basic concepts. And then it lists those out. So, data literacy is, like we said, the ability to read and write. Data analytics involves the next level, examining, cleaning, transforming. And a data scientist is the hardcore person that gets into the programming and all of that. What we have as an advantage today, and what I have read previously, all these tools that we have now that can do data scrubbing, that can do automated programming, you're not going to need as many data scientists. So don't sell yourself short when you're looking for that next job. Data literacy is the first step into your advancement of your career. And more importantly, helping your organization clean up the mess that is healthcare and improve the patient outcomes, reduce the costs, and all of those other things. And if you then feel like you are truly literate, then I think you can be an analyst, because there are so many other tools that you can learn about that then allow you to take it to the next level and help answer some of those more complex problems.
That's awesome. So do you think that, I'm assuming you don't think data literacy is just a buzzword for today?
No. I think it's going to go a lot further as organizations really look at how are they going to differentiate themselves from other organizations? How are they going to make better decisions? They have to start using the data, and the staff that they have are the place to start. We all know there's three openings for every person that's out there in the job market or something like that. So there just aren't enough people. And I'm a huge advocate for upskilling and working with what you have and just enhancing some of those things. And there's a whole strategy an organization can take, from doing a gap analysis to assessing needs, developing curriculum, all of those things, to have a true program that I think is going to be core to going on. And I have a quote that we'll touch on later that I think can solidify that, which I've thought about, but it's definitely, I think, going to happen. It's going to become required, just like not to leave out health literacy, which also connects to health equity, which data literacy is also going to be an important contributing factor to having better health equity across all avenues. Because some of the literacy skills that they talk about, how many times have you seen a visualization? Somebody's created a fabulous graph, Tableau, Power BI, even Excel, and you've looked at it and you've gone, I have no idea what this is telling me. So one, they either picked the wrong graph, which I'm going to hope is why you don't understand it, but then it's really being able to read visualizations and understand just that construct so you can use it to do something with it. If you're looking at something and somebody's presented it to you, why? Why have they done it? And if you don't know what to do with it, ask questions. We always need to keep asking questions. And then I think understanding the bias that we're seeing in some of the data, some of the research studies for drugs, they pointed out the population didn't represent the full population that was potentially going to have access to it. You, as somebody data literate, would say, show me what was the sample size? What was the population? Did we have different ethnicities? Did we have different ages? Did we just have men? Did we just have women? The bias is another key piece that being data literate can help you understand that. And then because the person may be doing the analysis or the programmer, they maybe don't understand those unique differences, but you as the data literate person or the subject matter expert has a tremendous opportunity to help educate and inform them because you understand where the data is coming from and you've looked at it to know this is either a full set or it's not, or it's incomplete, or something just doesn't look right. Going back to my admitting diagnosis versus final diagnosis, and being smart enough and then confident enough to speak up and tell them maybe they're not doing the right thing.
Yeah, and I want to go back to something you said in the beginning or earlier about the literacy as a nation. I'm pretty sure it was Bush's wife because the No Child Left Behind. I think that was a Bush legislation or movement. I think so. Maybe that.
We can add in the Tennesseeism of the week with the literacy piece as well, because Dolly Parton is one of our shining stars of East Tennessee, and she's big on literacy in young children. And as an East Tennessean, when my children were born, well, they were automatically enrolled in the Imagination Library, so they got books sent to the house every month for from birth until they hit kindergarten. And as you say, it's critical for a young child to have access to that and to be read to and to learn how to read to get to literacy. But it's also critical for us as professionals to understand the data and understand how to utilize that data with context to give us the data literacy. See, it's starting to click. You guys are teaching me.
Okay.
Yeah. And STEM is another thing. So Keith, data literacy, probably we can't really talk fully about data literacy unless we mention STEM, right? Where I grew up with Peter Cottontail books, right? And Burr Rabbit. Now we have children who are reading maybe those same kind of stories, but they're also needing to understand science, technology, engineering, and math in a whole new way. Any thoughts on that?
I totally agree. And, I'm a huge supporter of STEM. And as you know, or may not know, the Bureau of Labor Statistics and the ONET codes are how they classify all the jobs. The Bureau of Labor puts every job that's out there, believe it or not, into a list of codes. Health information has kind of struggled for years trying to get them to parse out ours into different levels and understanding the complexity of the curriculum. And the work that we do goes so much higher than what originally, when this started, 30, 40, 50 years ago. I don't remember the exact start of it, but it's kind of a struggle dealing with the government. They only make updates periodically. But health information has been designated as a STEM profession. I want to say it was either in 20 or 21 very recently, so that we can help encourage those kids that are wanting to get into science, technology, engineering, and math types of fields, that we are another option. We're not usually the first top of mind. I know I was going to med school when I started and found this career, and obviously I didn't. Many others, it's kind of an accidental thing. So how we build upon that, and there's funding for that. But I also think, going back to the reading program, and I'll just say this: if you get Dolly Parton to help promote data literacy, I want to come back and be on that podcast with her. But perhaps we can talk to her and kind of get back into
That'd be
the
awesome.
but it's there's going to be funding available for this through a variety of sources. So people looking within their organizations, foundations, the government, there's going to be grant funding. There is a lot of funding out there for STEM education to kind of marry these together, because I am a firm believer in education, but oftentimes people struggle with financing it. But we're going to have to figure out a way to pay for this if we want to truly improve the healthcare situation that we have today, because data and the ability to use data to make decisions is critical. And oftentimes, as we're all aware, mistakes happen. Error is human, and the reports that came out years ago, mistakes are still happening. And even now, when we have all this data, it's not making it available at the right time or the right place.
Yeah. What are some of the ways? I want to go back to the STEM discussion at the end if we have time. I want to talk about our next generation and our current health information professionals. But what are some of the ways, Keith, that health information professionals today can be involved or lead conversations around data literacy, maybe respective of their role or maybe just in general, however you prefer to answer?
Let's start with what I already said is we need to solidify in our minds the competencies we gain through the curriculums that we have through all of our educational programs. Now, granted, for me, that was a long time ago, but I, keep up and I can look at the current curriculum and I can assess whether or not I have competencies in those things. But I think we need to go back and really look at what is in our curriculum. And I've talked about this with job descriptions previously, that we often forget, what did we learn and what do we know? And then you're able to go, I can apply that knowledge, or I'm able to do all these things, and it's because of that. So it's reinforcing the knowledge that you already have. And some of the things that I think fit in very well with data governance, information governance is kind of that data analytics, data literacy. It's one of those terms that kind of has a lot of terms, and health information kind of started to steer away from that. But I think foundationally, we are the right people to start those conversations talking about quality. We're still in the traditional healthcare organization, making sure that the quality of the information is theirs, the completeness, the accuracy, being the custodian of records and all of that, and having to go to court or whatnot. We are the owners of quality, and quality is a foundational aspect, I think, of data literacy. So you can kind of check that box off. Security. We also, while we can't lock up the paper like we used to back in the day, I had a file cabinet in my office. We now are able to do auditing, access controls, locking stuff up. The security of the information and the protection of it, I think, is another part of data accuracy, data integrity, but it's a data literacy thing. When you're going to start, just as an example, importing patient-generated data, okay, where's that coming from? How are you validating that? How are you identifying that? That's a data literacy piece. You may or may not want to make a truly critical decision if it was patient generated versus it came from a healthcare provider who hasn't even validated it yet. Privacy, another core thing that I think fits with data literacy: who can have access to it, who shouldn't have access to it. Really understanding as we begin to parse out private or sensitive information that has added privacy regulations attached to it. If we want to become more self-service, comply with the information blocking rule, which is a whole nother thing you guys are probably going to talk about at some point. We have the ability to start to tag things because we understand where's all this information coming from and why and where those definitions should be applied. And then just being stewards of information. I think stewardship is a shared job across an organization, but I think health information understands where it's all coming from and understands kind of the big picture, the global picture. But we need to create stewards of information everywhere so that hand in hand with data
Mm.
literacy, we're truly owning what we have. We know where it is, we know who has it, we know the expert, and we know how it should be used or when changes need to be made. That's a core piece. And so that kind of data governance framework, I think, is a great place to start in creating the value. And oftentimes organizations only do things when they have to or when there's going to be a penalty. And I think information blocking and the quality measures and some of those other things that we're beginning to see, value-based care and whatnot, those you can kind of leverage that and then sell yourself, your abilities. But then we need to educate others. I think above all, just like privacy became everybody's job in a healthcare organization with HIPAA, data literacy needs
Yeah.
to be a competency across the organization. And why
Oh,
should
It's
I
a
love
bit
that.
overwhelming.
Yeah.
It's overwhelming, right? Like from my perspective, listen to this going, it's a lot. Like part of me wants to go back to the good old days of just the paper medical record and living in the basement of the hospital because there was some simplicity to it. And
Yep.
now, I guess another Tennesseeism is we always say you put 10 pounds of stuff in a 5-pound bag. Technically don't use the word stuff, but for this purposes, we'll say 10 pounds of stuff in a 5-pound bag. And it's kind of where we are in the electronic data world. There's a lot of data that has to be managed and mapped and tagged, and to get that context is a critical job. And as a health information professional, what are some resources out there to help with the data literacy efforts?
Well, I think you can just Google. Google is your friend. When all fails, Google ChatGPT. I'll admit I've been using ChatGPT quite a bit lately just to kind of test it out and see how it works. But what I personally have looked at is Coursera. I'm taking a course right now on through Coursera to be a Google Analytics, have a Google Analytics certificate. We'll see. I'm about halfway through, but that just has surprised me how much I actually know when you start to look at the use of Excel as a way to understand data. And, Microsoft's been around for a long time, but you forget the power of certain things and you take things for granted. But I think Coursera is a great resource. Some of it's free, some of it you have to pay for. But there are, like Harvard has stuff out there. There are a lot of other universities that have things, whether you want to call it a MOOC or using Coursera is kind of the same thing. EDX, small ED, capital X is another resource that I found. DataCamp. I'm actually also doing some work with DataCamp to understand data analytics. So I've started using R. I've taken a SQL class and now I'm taking programming. They're very similar, but they're different. But just spending a little bit of time, a couple hours every day or during the week, I think you're going to have to add the time to do that. Just like when you were younger, to learn how to read and write, I think we need to kind of go back to some of the basics. And then Udemy, Udemy is one of the other places, and those have formal courses. Some of them are eligible for college credit. And then many of them have a certificate option at the end. So you can go ahead then and take a course, and then you can demonstrate that competency, which, there's a lot of different ways to do that. So those are a lot of them. And then just a lot of universities, community colleges, I know are offering, a lot of programs. I think our health information schools are offering a lot of this information. And then there's a lot of people out there wanting to come in and help you set up a data literacy program as well. So I just think you have to do your research, do your homework, find out what's best for you from a time and cost perspective, and what are your objectives for what you want to accomplish. But I think organizations would be well suited, and I have started to see chief health data officers or chief data officers out there. I think it's going to kind of be a new opportunity for a career. And I think health information based on, I'm a broken record, the foundation that we have on our education, because it covers clinical, legal, business. We're the translators, we're the bridge. We already kind of know where all the data is coming from, but we just need to validate our skills, supplement our skills, and enhance our skills. One thing I'll just read a quick quote because I'd referenced it before. In 2022, Forbes ranked data literacy as the second most in-demand skill for over the next 10 years, only after
Wow.
digital literacy. And the
Wow.
U.S. Bureau of Labor
interesting.
agrees that data-heavy roles are among the fastest growing jobs, with data
Mhm.
science roles expected to grow 36% between 2021 and 2030. So I think
36% growth is huge.
That's
yeah.
huge. Yeah.
Now, it said data science, but I'm going to go
Mhm.
back to what I said. Don't get scared off by that because there's plenty of tools that do all that heavy lifting.
Absolutely.
You can be a data analyst. Once you became and confirm your data literacy, you can easily become a data analyst. The tools are out there. You got to invest the time. But it's cool. I love solving problems. I love, mysteries. I did
Mhm.
coding back in the day, actually, and I liked it. You read through a record and you try to figure stuff out. You pull the clues together. You have to hunt all over the place. That's if you like to do that kind of stuff, which I think could be exciting for people, bringing in the new
Mhm.
generation. It's solving problems and putting a puzzle together.
Yeah, it is. It very much is that. In fact, I spoke with Seth about this before, how what pulled me in was the power of coded data. That's what actually pulled me into to the profession, because you can, as an investigator, you look at a medical record and then you tell a story through codification. So that's really, I mean, I agree with you. I wonder, Keith, one question that I wanted to follow up with you. You're talking about R Studio, or R and SQL and different techniques, and code, not medical diagnosis coding, but computer code.
Correct.
Um, so one of the things I was thinking, as you talk about data scientists and how that's going to grow, and we are so absolutely, you're right, we're so foundational in the knowledge of the content itself. Do you envision a place where we have health information trained data scientists who are that content and can read and do visualization and even look at the visualization of data and make determinations,
Mm-hmm.
partnering with statistician type people who can run a two-way ANOVA and figure out what that says about the data?
Right.
What are your thoughts on that?
Well, I think unfortunately we're going to have to beef up our statistical skills too.
Okay.
Yes, we're going to
Yep.
want a partner, but we're going to have common language understanding. If you speak
Mm-hmm.
English and you speak, Spanish and you speak, some other language, things get lost in translation. So we need to have some
Mm-hmm.
core basic, which is why I think data literacy is like the foundation. There are going to be people who are more apt to do complex statistical computations, but I think we also
Mm-hmm.
might need to have a little bit more knowledge to be able to do some of the basic stuff ourselves to
Yeah.
understand. And the technology builds in a lot of that stuff so that you don't really have to know all of the stuff that back in the day, if you were using a calculator, I'm not going to say an abacus, but a calculator, the big one when
But you
I was
almost did.
first. But it's part of our advancing. There are skills we need to have. I've been looking at
Mm-hmm.
just the future of coding and what are the advancements of the skills. And coders are going to need to have analytical skills, statistics skills, some of the other things. All health information people are. You then have partners that are the more robust, complex stuff, but you got to be able to talk to them because if they don't understand what you're trying to do and you don't understand what statistical model that they're applying to it, we're going to get. So we've got to come to a meeting of the minds and a sharing, and then we complement each other versus sometimes in the data field, everybody feels like they're competing. I want to own the data. Data is power. Data not shared is worthless. So we've all got to
That's right.
start working together, playing the same sandbox together.
Yeah, absolutely right. Seth, any follow up?
No, I mean, I feel like, the old saying of rising tide raises all boats, right? And this has been pretty fascinating for me to understand. I think in reality, we are all doing certain aspects of data literacy as health information professionals in any role that we have. Now it's sort of putting a moniker to it. And I understand what that is. I guess the only follow-up question I would have would be, the difference between data literacy and information governance. That's still in my mind of, is there a difference, and what's the separation there?
I think data literacy is like the language. And then with that language, you apply it to information governance, because it's really understanding data at its core. And then governance is really about putting a framework and a structure around it. It's to establish, retention, privacy, the integrity, ownership, all of those things. Everybody needs to be data literate. And then there's different parts of it that then support a data or information governance program. But if you're not data literate and you try to put the program together, it doesn't even make sense. You can't even, you don't know how to speak the language yet before you try to tackle it. But I think it's a way for those things definitely work together. But this is a way for health information professionals to promote themselves within their organizations, because data is money. There is lots of money. Everybody is using data to make money. And we're in healthcare. We need money to take care of our patients. We need money to help people not get sick and all of that, population health, all of those things. It's a vital resource within organizations that right now is sitting on a shelf somewhere or in the cloud, just taking up space because nobody knows how to use it, or they don't even know it's there.
Right.
Yeah. Very good. So we're going to get ready to close up. But before we do, I said if we get to the end, I wanted to try to get something in if we have some time. And so I really just want to go back to the STEM discussion for a second, just to say, if you're a health information professional and you don't really know STEM, just STEM, just look it up and find some information about it and upskill yourself there. That's a really great place to upskill. And you can do that in a lot of different ways. Keith had some rewind this and listen to where Keith is talking about the different ways to upskill or the different resources out there for upskilling. But Seth, I was going to tell you that just yesterday I got this book called STEM Like a Girl. Now I have a grandson and a granddaughter. One is 3, one is 4.5. And I bought the STEM Like a Girl because it's out there and it's published, and so I bought it. But we will be STEMing together, the boy and the girl. So we're all going to be doing these STEM projects together. So I guess what I'm thinking is, if you have young people in your life, find an age-appropriate STEM project to do with them, or a STEM book or a STEM program, just to get them thinking on how to look at multiple pieces of something to build a solution for whatever X is, whatever you're trying to solve for. And I was just going to ask you, Seth, are your girls doing any STEM projects? I'm sure they do as part of school, but do they do that stuff for fun?
They do a little bit, and there's a gentleman on YouTube that his name's Mark Rober, and he's an engineer, and he's done some pretty amazing things, and he's got a company called Crunch Labs for kids to do engineering projects, and Crunch Labs is not a sponsor yet, but they're fantastic, and my daughters love those things because it shows them how things come together through a STEM education. His is primarily around engineering, so it's a really great thing for young kids, and it's also fun for older kids like me that get to play with these toys and see how those work. So this has been a lot of fun. This has been a great episode, and Keith, we want to thank you for being a part of this. And
you bet.
This was really good for me personally. I hope it was good for our audience as well to learn about data literacy. So thank you, Keith.
You bet.
Thank you, Shannon. And I do want to thank our sponsor of this episode today, which is Enterprise Social Record, the only closed loop referral solution for social determinants of health needs built with health information expertise. ESR allows clients to assess, refer, report, and trend the SDOH needs of people in their care and report quality metrics like HEDIS and MIPS. ESR provides real-time CBO engagement in community-specific ecosystems with Z-coding and engagement in an anti-fraud framework. For more information, visit www.enterprisesr.com. And Keith, Shannon, thank you. Shannon, I'll see you soon.
All right. See you next time. Thanks.
Thanks.